So here are some tips about how you can communicate with someone with a neurodegenerative disorder. So number one, focus. Don't try and communicate while you're doing 101 other things. Give them your full attention. Then they know that you're ready to listen and that you've got the patience to persevere with whatever their communication challenge is. Number two, consider your position. So get down close to them, get to their eye height so that they can see your face, they can hear you, and they know that you are going to be patiently waiting and listening for all that they've got to say. Number three, really consider where you are. If you're in a noisy environment, but that's perhaps not the best time to have a really detailed, in-depth conversation. So if you need to have those significant conversations, move to a place that's quiet and there's fewer distractions so that you can both really focus on what you're actually communicating. And then, of course, the next thing would be just consider your timing. Sometimes it's a good time to have a conversation and sometimes it's not. So one of the general factors of someone with a neurodegenerative disorder is that they are on often a whole host of medications which can cause varying degrees of alertness throughout the day. So pick your time. So try and have those conversations when someone is really alert and prepared and have got the energy to actually engage with you. Then again, keep it simple. So speak in short sentences. Speak plainly, say what you mean. Don't get too tied up in lots of descriptions. Just try and stick to the point. This is particularly for people who are having some cognitive issues as a result of their neurodegenerative disorder. Just say what you mean and keep it simple. And of course, be patient. It will take time for the person that you're communicating with to get their message across. So show them that you've got the time to wait while they actually formulate the words, think the thoughts, and convey them to you. And then finally, tip number 7 is use tools. Use whatever tools you've got available to support the communication. So whether it's assisting with maybe some signing, some gesturing to help them understand, or for them to be able to communicate with you, whether it's writing something down if you can. Perhaps it's as simple as an amplification system so that their voice can come across louder so you can more easily hear them. But use whatever AAC supports that your speech pathologist recommends, because they're there to maximise communication and give you the best outcomes. So for more information, read the blog, go back and check on those tips and let us know about your experiences.